All right, here we go. So the main event. Oh, I'm so excited. So please help me welcome Dr. Oni Blackstock, who is just internationally renowned as a healthcare equity expert, researcher, transformer, and hint, hint, former computer scientist. I hope she talks about that. She's a primary care and HIV physician and the founder and executive director of Health Justice. I urge you to go and check out her website. And this is a consulting firm that supports different healthcare organizations prioritize anti-racism and equity. She also leads the Grounded Innovation Lab, Health Justice Research and Design Arm, advancing frameworks for community governance of health AI, which is what we're going to be focusing on today. And Elle Lett, who I said, Elle's been here at least twice and may be on or may not be on. I'm not sure yet, but Dr. Elle Lett, listen, ISI 2022. I always say to those of you who've been to ISI, I claim you forever. And so is a Black transgender woman, statistician, epidemiologist, and physician currently doing her residency in emergency medicine. She is a powerful voice. I'm so absolutely thrilled about the sort of groundbreaking work she's doing, applying to intersectionality, to machine learning, and all of that. She's really carving a path in that space, and risk of algorithm fairness and clinician prediction models. And she's the co-author on the American Health Association's scientific statement on the use of AI for improving heart disease outcomes. And so with that, I welcome Dr. Blackstock and Dr. What did she say? In what spaces, strategies, are you seeing communities being engaged in this conversation with all the folks that Dr. Lett mentioned? So I guess with the statisticians, you call them informaticians or something?
Informaticians,
Yeah,
yeah.
yeah. So what spaces are you seeing these conversations being had?
So maybe I'll just start. So that's part of the research that the work that we're doing. So I'll just say really quickly, we have a project with the City University of New York School of Public Health Harlem Health Initiative, just a few blocks on 125th Street from where I am right now. And we are going to be recruiting community members, creating space for community members to talk about, if, how, when, and where they want these technologies to be used in their lives and in their healthcare. And we'll also be bringing in some of the stakeholders that Dr. Lett mentioned, like technologists, representatives from health systems, policymakers, to also sort of listen and hear what community members are saying. And the goal is to create a community-centered governance framework for health AI, and to document this process that we're using. We're going to be doing some speculative design work. We're going to be doing some governance labs, and out of it comes this framework. And hopefully we'll be able to create something that can be replicated by other communities, but basically says, like, community-based organization could give this to a health system and say, this is what we find acceptable or not. Like, we want community members to decide what is considered successful for an AI system, or what is appropriate use for it, or as Dr. Lett said, when it should be paused or stopped, or defining what harm is. So that's some of the work that we're working on, and just trying to create space, because community knows what it wants. I think the thing is, we need to make sure that folks have the information they need to make the best informed decisions. And so knowing a little bit more than the general population, we're hoping to do that here in Harlem. And as I also mentioned, I worked with Black Health that's based here in Harlem, and we had an AI decoded webinar maybe about a month or two ago, and community members had so many questions. So even just to create spaces where folks can get their questions answered and they can be informed users of these systems. Sometimes we don't have a choice, but we can say, okay, this is how I want to engage with it. What are some protective strategies? For instance, I know I was in communication with an Indigenous scholar in Canada who was telling me about how an Indigenous community member shared a community story with someone out of the community, and that person put the story into ChatGPT, which was a huge no-no. So, again, people need to understand, what are strategies that we want to protect our culture, our data, and what are other ways that we want to engage with these systems in ways that may be helpful for us.
So this is a good
Yeah.
point for me to ask you about Dr. Lett, and then I'll ask the other question. I want you to talk about Orchid. Dr. Lett.
The only thing that I would, yeah, actually, I don't need to add anything. Go ahead.
Sure.
I'm okay.
No, Dr. Let
hmm
go, go,
Yeah, I
go.
really want to hear what you're thinking. What are you thinking?
No, I'm just thinking about the literacy, AI literacy as a equity frontier across multiple domains. Like
Mhm.
on the same hand that I want all of us to be more careful stewards of it, I also don't want barriers to education and access leaving people behind as being people who can benefit from the utility of it. And so I love that you're bringing it to community answering questions. Like I want people at the barbershop to be thinking about how AI can help their lives. Like I do, I want that experience for them.
Yeah, yeah, and it's such. Can I just say, but to piggyback on what Dr. Letts said, like it's such a balance, I think, because I think there is this sense of like, when this like FOMO or like, being left behind at the same time as like we also are dealing with technologies that, are embedded with deep isms and phobias. And so just figuring out how do we move forward in a way that is, accountable to community, is safe, is respectful. I don't know. I always, my framing has kind of changed as time has gone on because have been submitting a lot of grants related to this work. And initially it was like, we can't get left behind. Like all of this is happening. We have to be at the table. But at the same time, I was like, wait a minute. Like, do we want to always be like engaging with these technologies in this way? Like, I don't know. I don't know. I don't know. So, I think what I've come to is that when we're informed, then we can figure out what's best for us and for our communities.
So speaking
Yeah,
of
because I mean, I
framing,
think there's opportunities. This is the last thing I'll
No,
say.
no, go, go,
Well,
oh,
go,
last,
go, go,
I think
go.
there's opportunities to like use, and I brought this up before, and it always makes other people uncomfortable. But I'm like, there are ways to use AI as a corrective thing. Like
Mhm.
you can overrepresent marginalized communities in data sets to as a way to account for historical biases. Seems uncomfortable, but you can build it so that the model actually preferences them in a way that it hasn't previously. Now, what's the multiplier? How much do you want to make the error return count more for them as you fit the model? Like those are things, those are uncomfortable conversations that people have to be willing to address. But you can do it.
But then, Dr. Leb, but like you were saying before, though, like because of the embedded, there's some things that we can't get at,
There's some things
we
you
can't do.
can't do
Yeah,
it.
even if we
It's a
over,
it's a mitigation strategy. It's not a
right,
removal strategy.
right,
Yeah.
right, right. Yeah, so that's the challenge. And just to say, like, there's something called frugal AI. There's a school of thought called frugal AI, which is, you know, everyone knows like with speech to transcription services, where there's a very circumscribed, narrow purpose or use case for the AI, where it's not like, it's like right now with these, generative AI, it's this huge, these humongous data centers, everything's hyper scaled. But we do know that there are some applications where if it's a narrow application, if it's an adjunct, it's not trying to replace a human being, where it's not having these crazy environmental impacts, then that may be something that's like helpful. Like we all know speech to text that is helpful for a number of groups of people, of communities, things of that nature. So again, we don't have to do things the way that like things are happening. Things can be done differently. And it's not an issue of like whether or not to use this technology. It may be about like, again, how best to use it, knowing what you know, and also just being stewards of the land, of the environment.
Yeah.
How can we reduce the harms we know that are being done now? And just to say some of these the ChatGPT Claude folks, they're like talk about catastrophic risk about these systems, becoming autonomous and causing all this harm, but like harm is happening now, right? Like we have
Yeah.
huge issues happening now.
And I totally agree. And I just want to make sure that my position isn't being. I'm thinking of it like as a community level. I think AI can be used for good, and the way you're
Yeah.
framing it is that I just think there need to be people who are firmly nested in protecting it from a fairness standpoint, not protecting it, but protecting us from unfair implementations of it. And I think that they are few and far between. Until fairness becomes part of everyone's pipeline, there have to be people dedicated to it. You know what I
Yeah.
mean?
Yes. Yes. And I also want to just also say that it's based on, it's math and statistics and probability. And just also, we need to remember that AI is it's sort of a catch-all, like you were saying, Dr. Bowleg. It encompasses a lot of different um, types of technology, but sort of in general, it is about surfacing patterns in the data and making predictions based on those patterns. But like it is something that can tell us that 0.001% of the time that 2 plus 2 equals 5. Like we can never like give our full trust
Yeah,
to something that operates on probability. And so I think people
yeah.
need to like also understand that when they're dealing with it. So that's one thing I wanted to say. There's something else, but I'll take it
So
back to you.
wait, I'm going to jump because I want to make sure that you talk about your work, each of it, and then I'm going to just open it up and
Yeah.
so talk about the ORCID framework, Dr. Blackstock, that you developed to assess organizational readiness for community health AI partnerships. What was behind the ORCID framework? What gap were you trying to fill with
Yeah,
them?
I think I've been someone obviously from communities that have been negatively impacted by all the various isms and phobias, and then also have been a healthcare practitioner, have been in public health, have been have part of these systems that have done harm. Um, and I just wanted to create something where we were, it's kind of aspirational thinking about if you're a health organization, what are the conditions, like what are the preconditions that should be in place before you embark on like installing some AI system, right? And I think that again should be determined by what is your relationship with the communities that you're providing care to, what are your commitments to health equity, what are your practices around power sharing and resource sharing, and also to have community members or community-based organizations come to you to ask you for help for say that we have this priority, we have this need that we've identified, we want it to work with you on it. Because again, what's happening is that organizations are like, oh yes, let's do this AI system for this or that. Like, you know what I mean? They're not, no, the community is not being consulted. I read there was a scoping review that was published last year. It said 0.2% of published health AI studies include patient or community input. 0.2% of published studies. So like all of these things are being built, are being designed, implemented, and there is basically zero input from the people who these systems are going to impact. So basically it's kind of a sort of a flow chart for organizations truly to think through if there is a system or more like a problem or a need they want to address, bring it having that conversation with the community and saying, let's work together and figure out is it a clinical solution? Is it a structural, is it a policy? Does AI need to be part of this solution, if at all? And maybe AI isn't the answer. If community decides they want to pursue AI, then the organization has to be willing to those questions that Dr. Lett mentioned. Can community decide on what's success and what's harm? Can community decide on when to halt or pause these systems? Like really have shared leadership when it comes to how these systems are being designed, implemented, what the oversight is. And so it's aspirational. I know like health systems have to deal with their own constraints, but healthcare is it's such a high stakes area. And um, what is happening with all of these systems being implemented is this scaling of harm at this unprecedented level. And so, because of the harms that have already been done, because of the potential harms, we owe it to the communities that we're caring for to have these conversations and have their leadership in making these decisions. So that's how I feel. I know most of health systems, they're not going to listen to community, but they can maybe choose one or two questions. And it's about aspiring to maybe we can't do this, but we can do this. Yeah. And so that's
Are
what the
there any
background.
model programs that you've seen? Are there any healthcare organizations who are doing it right in terms of engaging with community
I,
before they build and scale
Yeah,
systems?
I was actually looking this up ahead of ahead of our discussion, and And if folks know of any, please share. But in my search, I couldn't find any. And just even in terms of just participatory sort of approaches to just health systems work with communities, I think I just, I was mentioning I got back from Rio a few weeks ago, and Brazil has a really great system around participatory decision making within their health system. So bring in community members, CBOs, and that's as much as I could find. That's on health decisions in general. But when it comes to AI, it was like 0.2% of published studies. People aren't asking any of us what we want or if we want to deal with these systems.
Mhm.
Yeah, so first of all, I need to read that because that sounds amazing. I love that it's aspirational because it gives us something to guide us by.
Yes.
I think part of the reason why, so I'll say two things. One, AI is almost never the only part of a solution that I've seen in my experience.
Mm.
AI is, especially in health, health is very specific, but even from the standpoint of like who has medical legal liability, there has to be a person somewhere along the pipeline, but just the way it works for like who can assume responsibility for it. So AI alone is almost rarely, I can't think of a context where AI by itself could be the solution in healthcare. Maybe you might disagree, Dr. Blackstock, but
No. But that's exactly what I was saying about the frugal AI, like, where
yeah,
it's like an adjunct. It's not trying
yeah,
to
exactly.
replace like a
That
human
I
being.
agree.
Yes, yeah, I
Yeah,
agree.
yeah, but there are like pushes like in this. There are arguments of like trying to replace AI on reading completely certain types of scans and things like that, and I think that is
Mm.
going to run down. And the other thing that I wanted to say about, I feel like the core sort of praxis around AI development that I've seen, even if it's not what people say, is a question of pace. Like all the AI products I have seen, especially in industry, are like about making things more efficient and moving fast, which to me is very much at odds with the community participatory approach. And I think that from the jump is where things fall apart. Because if you're screening a bunch of grants and they're talking about this AI tool that's going to make this more efficient and save this money, you're saying I need 3 years to get the question.
Yeah.
That's like a very different and I think that part of the work of it is to have a governance for community for like framework that you can point to and say, hey, this is what we're collectively agreeing is the best practice for doing it. Give us money to take this approach and show you that
Mhm.
it's the best practice.